The Pharmacist's Guide to Managing Side Effects of Blood Thinners. Disclaimer: this video is for educational purposes only and is not a substitute for professional medical advice. Always follow the specific instructions from your doctor and pharmacist. Welcome back to PharmaconHealth. If you're taking a blood thinner like Warfarin, Eliquis, or Xarelto, the constant worry about bruises and cuts can be exhausting. But managing this medication is a skill you can learn. Today, I'm giving you a comprehensive 3-step protocol to replace that anxiety with confidence. We'll cover exactly what to do for minor bleeds, the critical red flags you must know, and the daily habits that form your best defense. Let's start with step 1, mastering minor bleeds. It's not a matter of if, but when a small cut or nosebleed will happen, your goal is to control it calmly and effectively. For a small cut, your first and most important tool is direct pressure. Take a clean gauze pad, apply firm and steady pressure directly to the wound. Here is the critical part. You must hold it for a full 10 to 15 minutes without stopping to peak. Every time you lift the gauze, you disrupt the fragile clotting process and have to start the clock over. To enhance your control, I recommend a hemostatic agent. These are clot-promoting gels or powders available at any pharmacy. They're a game changer for at-home care. Keep one in your first aid kit and apply it directly to the wound before holding pressure. For nosebleeds, the technique is everything. Sit upright and lean forward slightly. This prevents blood from draining down your throat. Then, pinch the soft, fleshy part of your nose, just below the bridge, and hold it firmly for 10 to 15 minutes. Do not lie down or tilt your head back. Now, step 2, recognizing the red flags. While most bleeds are minor, you must be able to identify when it's a true emergency. If you see any of the following, go to the emergency room immediately. Do not wait. Red flag 1. Any head injury. This is non-negotiable. Even a minor bump on a kitchen cabinet can cause a slow, silent bleed inside the skull. You cannot assess this risk yourself. It requires immediate medical evaluation. Red flag 2. A large, painful, or fast-growing bruise, especially if it appears after a fall. A bruise that rapidly expands or is exceptionally painful could indicate significant bleeding under the skin. And red flag 3. Signs of internal bleeding. This includes vomiting blood which can be bright red or look like dark coffee grounds, or having black, tarry stools or stool with visible blood. Red flag 4. Feeling unusually weak, dizzy, or faint. This can signal a significant drop in blood pressure due to blood loss, even if you can't see the bleeding. And finally, red flag 5. Any bleeding that does not stop after 15 minutes of continuous, firm pressure. This is your sign that the situation is beyond home care. Finally, step 3. Your daily prevention plan. The best way to manage bleeding is to prevent it from happening in the first place. Think of your daily habits as your personal shield. First, become a bump avoider. Make simple swaps in your routine. Use an electric razor instead of a blade razor to eliminate nicks. Wear protective gloves while gardening, washing dishes, or using tools. Be extra mindful in slippery environments. Second, protect your stomach lining. You must avoid medications like ibuprofen, also known as Advil or Motrin, and naproxen, also known as Aleve. These and SAIDs dramatically increase your risk of stomach bleeding. For pain or fever, always ask your doctor if acetaminophen or Tylenol is a safe alternative for you. Third, maintain consistency. Take your medication at the same time every day to keep a steady level in your bloodstream. If you are on Warfarin, also known as Coumadin, this is especially crucial for vitamin K. You don't need to avoid leafy greens. You need to keep your intake consistent. Don't eat a huge spinach salad one day and have none the next. Stability is the goal. Let's recap. You are now equipped to 1. Master minor bleeds with pressure and hemostatic agents. 2. Recognize the life-saving red flags that demand an visit. And 3. Build a protective shield through your daily habits. Managing blood thinners is a journey from anxiety to empowerment. You have the knowledge. If this in-depth guide made you feel more confident and in control, subscribe to PharmaconHealth. We are here to turn complex medical information into clear, actionable steps for you. Click subscribe and tap the bell to stay updated. What was the most surprising red flag you learned today? Share it in the comments below. Thank you for watching.